Hello, everybody. Thank you so much for coming to our pre-conference webinar today. My name is Mackenzie Flynn. I'm the Policy and Annual Conference Manager at AIDS United. So excited to see so many folks here. But I can get us started by introducing our panelists. Next slide. Oops, sorry, tech issues on my end. Starting off, we have Michael Elizabeth.
I'm sorry, Michael Elizabeth, they, she. I happen to be the co-chair of the U.S. People Living with HIV Caucus.
Then we have Mary Ann.
Hi, everyone. My name is Marianne. I use she, her pronouns, and I am a lawyer with the Center for Health Law and Policy Innovation.
And then we have Drew Gibson.
Thanks, Mackenzie. Hey, everyone. Drew Gibson, he, him pronouns, Director of Advocacy at AIDS United. Happy to see y'all here.
And I'm going to provide an overview of the event as folks introduce themselves in the chat. We're going to start off with an overview of what AIDSWatch is, then we'll go into some logistics folks should know. We'll give a broad overview of our policy priorities, and then we'll talk about preparing for the Hill Day, and then lead into some Q&A. So please use that Q&A function in the chat if you have any questions or concerns that you'd like to raise with the group. But without further ado, I'll pass it to Drew to kick us off.
Thanks again, Mackenzie. Just for folks who may not be familiar with the event, or for folks who would like a little refresher, AIDSWatch is the largest annual constituent-based national HIV advocacy event in the country. Held for over 30 years. I think this year is number 33. Last year, we set some records with more than 630 advocates from 38 states, Puerto Rico, and Washington, D.C., who came to the Capitol and attended over 271 Hill meetings. We are set to break more records again this year. We have roughly 500 attendees already registered for the event this year, but we have folks from 42 states, Puerto Rico and DC, which is a high for us. We're really excited to see folks coming from all across the country to the event and having hopefully more meetings than we've ever had before, because the goal of AIDSWatch is to educate members of Congress about the important issues at stake for people living with HIV in the U.S., and also to help train up and get folks ready for their own advocacy back home when they return from the AIDSWatch event for the rest of the year. Next slide, please. AIDSWatch is a partnership between AIDS United, the Center for Health Law and Policy Innovation at Harvard Law School, and the U.S. People Living with HIV Caucus. We are extremely grateful for all of our partners in putting together this event and really think that we've got a great set of workshops and policy briefs ready for folks to utilize. Next slide, please. Meaningful involvement and engagement is essential to AIDSWatch and the event's mission. We try to ensure that people living with HIV are a part of the advocacy process and their voices are heard and help define policy. There is a tremendous diversity of folks attending AIDSWatch and who are also a part of the AIDSWatch planning process. We try to make sure that communities impacted by HIV are at the center of these conversations and that legislators are hearing directly from folks living with and impacted by HIV on these Hill meetings. Organizations like AIDS United, the Caucus, and CHLPI all have meetings with Hill offices on a fairly regular basis, but we know that they don't really want to hear from us so much as they want to hear from you, their constituents. Your presence on the Hill is incredibly important, particularly when it comes to representing populations that are particularly impacted by both the epidemic and the actions of the current administration in Congress. So youth populations, immigrant populations, folks with trans experience, people of color, and new folks who had never been to the Hill before and who are living with HIV, as well as women living with HIV. We do our best to try and make sure everyone feels intentionally included, and that folks who have both been to AIDSWatch before and who are new attendees feel comfortable or as comfortable as possible given the current political environment with their time on the Hill. We'll get to it more later in the event, but we will have state coordinators and Hill guides ready to help folks as they traverse the Capitol and as they prepare for the event itself. Want to make sure we're trying to attend to all power and privilege dynamics in the way that we operate this event and make sure it's really focused on community. I believe next slide, and I think we are passing it over to Michael Elizabeth.
Oh, perfect. I get to hear my boring voice. Hey, everyone. First of all, I want to give a shout out to a couple of HIV Caucus Steering Committee members. I see Deketra in the chat. I see Gabriel in the chat. We, of course, love you, and they have committed countless volunteer hours in helping this AIDSWatch partnership happen this year. And I also want to give a shout out to our communications guru, Juan Michael, who has always been uplifting the partnership messaging. So thank you both. I am happy to provide some logistics information. Next slide, please. As folks probably have already known, we have seen some impressive numbers, but you can still register for AIDSWatch at the link that I'm assuming will be dropped in the chat. I probably can do it right after I get through talking. The event, of course, would take place where it always takes place annually at the Renaissance Arlington Capitol View Hotel. And if you have any accessibility needs or requests or questions, please contact Sophia at Age United, and their email will be dropped in the chat as well. Please feel free to use it. Age United's team has been beautifully responsive and helpful with any triaging and questions that we might have. Next slide, please. As we travel to AIDSWatch and understanding the environment that we're in, we just want to make sure that folks know the specific details. And so the most commonly used airport, Regional National Airport, or DCA, is roughly a 5-minute drive from the hotel, and that is probably a conservative estimate. It's like next door to the airport. A little bit further hotel is the Dulles International Airport. That's a 35-minute drive to the hotel. And of course, we love Baltimore, but BWI is an hour and 45 minutes from the hotel. And it's just important to keep that in mind, especially as you prioritize where you want to show up on the AIDSWatch schedule. There will be some transportation support. There's a free airport shuttle service to the conference hotel Monday through Sunday. Huh? Okay, 5 a.m. through 11 a.m. And then there's also a complimentary metro shuttle service from the Renaissance to and the Courtyard Crystal, which is basically connected by a bridge. It feels like the same hotel. Yeah, I don't think there's anything else to talk about transportation. If you have any questions around transportation, the AU team can answer that for you. Next slide. Packing lists. Okay, so we all know to bring business cards, right? But like some of y'all are fancy, you might have them electronic business cards. You can be prepared to use those as well. Some clothes to bring. DC is very temperamental. And so obviously bring comfortable clothes, pajamas, one or two nice outfits, but come as you are environment as well. We believe in people showing up and presenting as their true selves. But you will have some spaces and meetings that you might want to have, what is your level up presentation, if you will, specifically on Hill Day for those office visits and potentially the congressional reception as well. We do encourage walking shoes because especially on the Hill Days and then rally, first of all, that rally is early in the morning. And if you want your shoes to start, your feet to start hurting at 7 a.m., then that's your business. But there will be lots and lots of walking for the Hill visits. Again, DC is very temperamental. And so have like a rain attire or umbrella, a jacket or a light sweater would be helpful as well. And of course, bring your personal care products. What's also very important is your medications, if it's applicable. Bring extra. I would actually bring like a week supply just in case something wild happens in the new world that we're living in. And of course, money for food. Now, AU gave me some specific notes. I want to make sure I catch them all. Yeah, Monday is mostly around getting to and navigating around the conference space in the center. Tuesday, we will be navigating around the conference center. I don't know what these notes mean actually, so I'm going to skip that and go to the next slide. We're going to go over what to expect right quick. So next slide. Oh, this is why that was important. Okay, Monday, we are doing, it's like mostly a half day. So there's going to be institutes throughout the day. And those are usually focused on foundational elements and opportunities for us to have shared understanding throughout the rest of the experience together. We highly encourage you to come to the welcome reception, which is co-hosted by the HIV Caucus. We have lots of special opportunities for engagement during that space. And also we're gonna honor some very beautiful and powerful leaders that I can't wait to introduce you to and help you get to know. On Tuesday, it's going to be like the first full day of AIDSWatch. That's when everyone is really fired up and pumped up. It's going to start with the opening plenary, which you're going to see some familiar faces on and some new faces. We're also going to have workshops to really ground us and really provide us additional knowledge and support that we might want to have for the Hill visits the next day, but also just quite frankly for the advocacy we want to do beyond AIDSWatch. And then what's also special on Tuesday, it concludes with a congressional reception, which is some of the most memorable moments throughout the AIDSWatch experience, where we also will be honoring some congressional champions, but also two additional community heroes that we all love. And then Wednesday is the Big Hill Day. And so that's what everything leads up to. And we hopefully to really have an impact with the lawmakers that decide on policy that impact our lives. Next slide. AIDS United really wants y'all to know what you're getting yourselves into. And so they have circled some key points for you to remember once you arrive. Like we said, on Monday's Institute Day, and then it concludes with a welcome reception. But look at these institutes, y'all. They're 1 hour each. I don't know how y'all gonna pick between them. So maybe divide and conquer between your social and professional networks when you arrive. But as you see in the red highlighted areas, those are the time slots. And so like as you arrive, consider arriving prior to the afternoon. And then you have 3 different institutes you get to pick from during each section. And then we'll have a wonderful opportunity to get to know each other and build new relationships at the welcome reception. Next slide. Now, again, Tuesday is that big first full day. Highly encourage you to take advantage of that free breakfast and then hit that stage. So you see the general sessions and plenary in the morning through the afternoon. We will have a lunch, but don't believe that that's a working lunch. You know, it's gonna go by really quickly. And then we'll have these amazing workshops. And again, I don't know how y'all gonna select between the amazing workshops that were selected for each section, but like there's gonna be plenty of options for you to choose your own adventure. And then we're gonna conclude again at the AIDSWatch Congressional Reception in that evening, 6 to 8 p.m. Next slide. Now, baby, some of y'all are brave souls and wake up at 6 a.m. to show up at Capitol Hill by 7:30 for that rally. That rally really does set the tone for the entire Hill Day visit, though, and it really provides an opportunity for AIDS United to amplify the advocacy and the work that we're doing together beyond the AIDSWatch experience. And then there will be a bus provided from the hotel to Capitol Hill, but that's at 7:30 a.m. Y'all, so I gotta be up early. And then of course, the rally starts at 8 a.m. and then the congressional meeting starts at 9 and they continue through 5 p.m. But individual schedules, of course, may vary. Next slide. Ooh, y'all have me using my voice today. Okay, social media and public visibility. This is really important, of course, especially in the times that we're living in now. You know, you will hopefully, I think if I remember correctly, get an AIDSWatch shirt. And you know, we highly encourage using them. They create great visibility options for us. It makes us look like the force that we actually are when we show up on the Hill, especially. And they're also great for photos. Be mindful of your social media posts, though. Check your privacy settings and be aware of any safety implications. Maybe not share your location on your social media. Just know that the times we're living in, and especially the people who we're protecting. You know, it is by attending AIDSWatch, you are consenting and authorized photography, film, and other recordings. If you have any concerns around that, I do highly recommend that you reach out to the AU team to see if any accommodations are possible. And then AIDSWatch won't identify folks in pictures and videos without explicit consent. And I would actually ask you to do the same if you're taking photos of other people, etc. Next slide. And then I get to hand it over to Mary Ann.
Thank you so much, Michael Elizabeth. Hi, everyone. So the goal of AIDSWatch is to educate Congress about the important issues at stake for people living with HIV in the United States. So on that first day, as Michael Elizabeth noted, we're going to be discussing some of the policy asks that we're going to be bringing to the Hill. The policy asks that we have prepared are broad. They cover a wide range of issues. We'll have a panel on Tuesday morning that is dedicated specifically to these policy asks. And in the afternoon on Tuesday, we're going to have a bunch of workshops available if you want to dive in deeper on a particular topic. We've organized our policy asks into 3 categories: access to care, impacted communities, and quality of life. I'm going to walk through the categories briefly now. And at the end, we'll have some QR codes up on the screen so that you can take the time to read through the briefs more carefully on your own. This walkthrough is not going to be exhaustive, so consider this your first pass through. The goal is just to understand what is contained in the briefs, and you'll have time to review the brief on your own before AIDSWatch, and we'll also have that panel again. So this is not the only time that you're going to be hearing this information, and not the only time that you'll have the ability to research things or to talk with your colleagues. And finally, before we move on to the first category, just you don't need to be an expert on everything. Nobody's expecting you to be able to answer questions about the specifics of a bill or why we're asking for a specific dollar amount. But you are an expert on you and your life story and what your community needs. So as we walk through the brief now, and as you read through the brief, figure out what resonates with you and what you might want to specifically raise in the offices that you'll be meeting with on Hill Day. Some of these policy asks you'll see in the brief come with an ask to support a particular bill or for a specific level of funding. And so having that particular information in your back pocket can be helpful. We'll go to the next slide and talk about our first set of asks, which is focusing on access to care. Medicaid and Medicare serve as the backbone of the U.S. domestic HIV response. These 2 programs together represent nearly 2/3 of all domestic HIV spending by our government. Any cuts or restrictions in these programs risks negatively impacting people living with HIV. And with growing populations and changing circumstances, we need Congress to make sure that these programs meet the needs of the people enrolled in them and are protected from efforts to dismantle them. Ryan White is the nation's safety net program for people living with HIV and provides life-saving access to HIV treatment and support services. It often will fill in the gaps when other programs fail to cover necessary healthcare. It's successful, it's effective, and we see threats and changes to our healthcare system generally. So it's going to be even more important to make sure that Ryan White receives the funding it needs to respond. When folks aren't eligible for insurance through their job or through programs like Medicaid and Medicare, they need to turn to the private insurance market for care. Enhanced premium tax credits used to lower the cost of private health insurance sold on marketplaces, but these credits were temporary and remain expired for millions of people. And we all know that the availability of insurance alone means nothing if you don't have the means to buy it or to be able to afford to use it. And then finally in this category, pre-exposure prophylaxis, also known as PrEP, can help reduce the risk of HIV transmission from sexual activity by 99% and from injection drug use by 74%. And it's important that Congress expand access to PrEP such that it doesn't matter, it shouldn't matter what type of insurance you have or if you even have it, that you still have no cost access to this preventive care. We'll go to the next slide to look at the second category of acts, which will focus on impacted communities that are the most affected or disproportionately impacted by the HIV epidemic and face some of the largest barriers to care. Everyone deserves access to the care they need, including care that affirms your gender identity. Folks who have been paying attention to the news will know that gender affirming care has been the target of attacks from all sides, with a particular focus on youth access to gender affirming care. And We know that stable access to affirming care improves retention in care, medication adherence, and viral suppression for trans and gender diverse folks living with HIV. So it's really important to protect access to this care. We also know that voting directly impacts public health outcomes. Voting helps shape policies, not only the policies that directly impact health, but also the policies that address social determinants of health, like transportation, early childhood development, employment, etc. So protecting these rights is essential to ensuring that the voices of people living with HIV are heard and incorporated in policy decision-making. HIV does not discriminate based on a person's immigration status or what type of documents they have. And recent federal policy changes have not only made living in this country as an immigrant much more terrifying, but there have been devastating cuts to immigrants' access to health care through public programs such as Medicaid, Medicare, and the Affordable Care Act. Access to healthcare is not only difficult as a matter of eligibility, but also as a matter of safety as we see increased ICE activity. So we need congressional action to ensure that immigrants of all statuses have safe and expanded access to the healthcare they need. It's also essential that people receive culturally relevant, non-stigmatizing, and comprehensive sexual and reproductive health care and education. With current attacks on bodily autonomy, it is important that Congress step forward to fund and protect pathways to reproductive health care. And then finally, the world is facing cuts to global HIV funding, which challenges a lot of the progress that we've seen fighting HIV worldwide. And Congress needs to provide partner governments with the best chance at maintaining and building upon decades of progress that we've seen so far. And then last but not least, we'll go to the third category, which focuses on quality of life. We need full and robust investments in holistic care and support for people living with HIV in every aspect of life. Access to HIV healthcare services is at the core of effective HIV care that only represents one component of care and support services that are needed. People often have co-occurring conditions that can complicate HIV care and a person's health and wellness. So medical care should not be siloed in such a way that we only have access to care related to HIV, but that we also have care for other conditions like viral hepatitis, sexually transmitted infections, substance use disorder, or mental health concerns. And we need to approach this care in a way that considers how these conditions coexist, interact, and recognize that effective care has to address the whole person, not just one part. Whether or not someone has housing is one of the biggest drivers of health outcomes for people living with and affected by HIV. It can determine whether someone has a place to be safe, a place to sleep, a place to store medications, to store personal belongings, to live in a place where they know that they belong. And thus housing programs like HAPWA is critical to supporting folks living with HIV. And then finally, over half of people living with HIV are 50 years old or older and are facing a multitude of challenges and barriers, including difficulties managing healthcare, increasing comorbidities, social isolation, stigma, etc. We need Congress to invest in dedicated strategies that address these unique challenges and invest in interventions that promote healthy aging. Go to the next slide, please. So if folks want to take out their phones now, you can get early access to the policy brief in English and in Spanish. What I described here is just a quick take on what you'll find in these pages. This brief is going to be included in the folders that you leave behind with your legislators' offices. So it would be helpful to become familiar with the brief and feel free to refer to it during your meetings. And as you read through the brief, I want to encourage you to think about whether any of the sections or policy asks really resonate with you and consider how you might be able to share a story that connects to that ask. You can include a personal story or maybe something more tailored to your community and the constituents that are that your legislator represents. And I thought I'd include a quick example of how that might look, especially as we head into talking more about the logistics of HILDA. So if, for example, the part of the brief that talks about gender affirming care or general discrimination against trans folks really resonates with you, you might say something like this. You're in the meeting. Staffer, thank you for meeting with us today. I just wanted to share that I find it really difficult to navigate everyday life sometimes, knowing that I will likely encounter people who won't respect who I am or honor my gender identity. Discrimination has always existed, but it's been more exacerbated when you know that your own government is committed to erasing your community from websites, from history, from research, and from healthcare. Transgender people are disproportionately burdened by HIV, yet if we don't ensure that the programs are safe for trans folks to engage with, how can we expect these programs to provide any form of realistic support? We need Congress to pass the Equality Act, and I hope that Senator Michael Elizabeth will step forward as a champion for the bill. Again, that's just one example. You should feel free to share whatever level of personal detail you feel comfortable with. Feel free to add in experiences from your own community, from your own life. But connecting it back to the policy brief can be more effective because now you're putting a face to some of the policy asks that we have in the brief. If you have any questions, please take the, sit with it. Feel free to Google some of the terms in there. I'll be around during the registration check-in on the Monday of AIDSWatch. Keep an eye out for someone with purple hair sitting at a table drawing posters for the rally. Even if you don't have questions, feel free to come and say hi. I would love to meet you in person. And so with that being said, I'll turn it over to Drew.
Thanks so much, Marianne. That was a really great overview. There's a lot of stuff to go through, but hopefully folks have the policy briefs now, either through that QR code or the links in the chat. We'll also be sending them out to folks via email, and you can familiarize yourself with the brief, and between that and the overview on Tuesday, hopefully get a good sense of what it is you'd like to talk about. But wanted to go over some of the basics for preparing for the Hill visits, both in terms of knowing the content, but also knowing how you're going to interact with your state leads and with offices on the day itself. So next slide, please. First off, we have Meet Your State group here for the Tuesday lunch listed. Prior to this and prior to the event, you should be receiving some form of communication from your state coordinator or Hill guide regarding your meetings for the upcoming AIDSWatch Hill Day and the other members of your group. We're going to be reaching out to state coordinators and Hill guides in the coming days to provide them with that information and hopefully give you a chance to say hi and get to know one another prior to the event itself. Soapbox will also be helping out the consulting firm that we use for scheduling the meetings. They have a web app that they share with us to provide updates on all of your meetings. And we are also here for any questions you might have. So if you have any questions, just make sure to reach out to AIDS United staff, either at the AIDSWatch email, AIDSWatch@aidsunited.org, or any of our individual staff emails. But the Tuesday lunch will be a time for folks to get together in person and just discuss strategy for how you want to go about the meetings, split up and discuss roles, who feels comfortable speaking, what they would like to speak on, if there are any particular meetings that folks have any trepidation around or would like to discuss strategy with their state leads, practicing with a friend around how to interact during those meetings and what your message is going to be. It's really a great space, and there will be AU staff sort of going around the plenary ballroom to answer any questions you might have while you're doing those. But we are really encouraging folks again this year to stick together, to stay in groups while on the Hill, and really lean on your state coordinators and Hill guides to help you navigate the Capitol. And If you do have meetings that you are scheduled for that you would not like to attend for one reason or another, we will get into the details of that later, but you are not required to attend all meetings if you don't feel comfortable. But if you do, we do encourage everyone to attend all of the meetings that are scheduled. Next slide, please. How to plan for the legislative visits. So it's always really helpful to list your various policy requests that you want to focus on in bullet points at the top of a sheet prior to the meeting, and maybe to write out some answers to some key questions for yourself so you have a better idea of what it is you would like to talk about. So, figuring out a big picture ask. I'm here today to talk about this issue because this really impacts me or my community, and this is why it should be important to you. It's important because, and then blank, we have the talking points asks portion of the policy brief that you can use to formulate your responses. But always remember that a lot of times these offices are looking for stories. They're looking for personal connections. So if you are comfortable, then sharing how policies have impacted you personally or your own life experience is always a great way to relate to offices and feel comfortable in sharing your story in ways that will make them more likely to follow up with you and your state delegation after the meetings are done to talk more depth around policy asks. There are going to be several calls to action in the policy brief, the asks section, where you can discuss whichever of the asks you feel most personally connected to or you feel the most important. Those are things that you can be talking about with your other state delegation members during the Tuesday lunch or prior to that via an email day. Again, have an ask that might be challenging to some of the members if you feel comfortable as well. So especially with offices that are allies of ours that we think are good on our issues, they're going to usually respond with things that sound really great and say they're supportive of our issues and that they identify with our movement. But we also want to make sure to press them on taking real substantive actions on things that matter to our community, and those will be included in those asks in the policy briefs. And again, if you don't know an answer to a question or if there's extra information that's requested by an office, it is always okay to just say, hey, I don't know that, but we can get back to you after the meeting with the information. It gives you a great chance to reconnect with the office after the initial visit, because hopefully these visits are going to be the first point in a long chain of communication between you and these offices as you work on trying to get them to take legislative action to support our communities. Next slide, please. Tips on talking to legislators. There's a lot of things on this slide that certainly I encourage you to look at and go through and think about how they sort of relate to how you were thinking about approaching or how you had approached legislators in the past. I think the biggest thing, though, that I've experienced and that I normally share with folks that are in my groups is that being in a space where you feel comfortable and confident in what you are saying is always going to be the most important thing, and acknowledging the spaces where you may not feel comfortable prior to going into a meeting so you can prepare yourselves for all possible outcomes. I know we'll go further into this in a little bit around potentially difficult offices, but most offices, even if they are with member offices that don't traditionally support our issues, are not openly hostile. Most times, if you get an office that is not supportive of our issues, the worst you're going to get is indifference or silence or someone who doesn't take notes. And being cognizant of that prior to going into a meeting and saying, hey, this might not be an office that is going to have a great response to us. What does a good meeting look like to me? What does success look like going into this office? And then making sure you follow up with that during the visit. So knowing if you have a hard ask, if you have a specific policy priority that you want to get across, that you talk with your other members in the group and make sure that you're able to share that during the meeting, and have that be sort of the thing that you are focused on. We also really encourage folks to take pictures, normally outside of the office in the hallway, with the staffer, with the member. But it's always great to be able to share those on social media if you're comfortable. And again, the follow-up is incredibly important. This should be the first step in an ongoing relationship with these offices, whether or not they are supportive, or whether they're not. So really looking at this as the kickoff for a year-long advocacy journey with these offices. Next slide, please. Engaging with difficult offices. So focusing on your story, what you are saying, what points you are making is going to be really important. If you spend too much time focusing on how the given staffer is reacting to your responses, you could get thrown off your game, you could get discouraged. A lot of times you can feed off really good energy with offices, and that's wonderful. But even if you go to an office that isn't taking notes, that isn't being engaged with you, just go ahead and continue to make your points. Make sure that your message is heard, and then know that you can follow up later with that office with a different staffer, or take a different strategy with other advocates from your state to try and drill your point home. But even if they are not showing visible reaction, that doesn't mean they're not hearing what you're saying. It doesn't mean that what you're saying isn't having an impact. A lot of times, we just don't know what's going on in the staffer's mind when we're meeting with them. Someone could just be stone-faced looking ahead at you with no visible change of expression whatsoever. And our initial response is, oh, they're not listening, they don't care. And next thing you know, we're getting a response from them via email when we follow up saying, oh, okay, I checked in with point X and point Y and point Z. And they were listening, they were paying attention, they just, have a really good poker face. So try not to pay as much attention to those types of more passive reactions. Lean on your state coordinators and Hill guides when you go to these meetings, and talk about meetings that you feel uncomfortable about prior to entering the meeting. So if you have an office with staffer that you might think there's a possibility of getting a negative reception, talk with your state coordinator about that and what the plan is for the group when you go in. If that office is openly disrespectful, if they misgender folks, if they are being just generally openly rude and dismissive, having a sense of what you are comfortable with and how you're going to, as a group, react to that can be really helpful. And coming prepared is always really important, so that folks can go into those meetings not having to think about all of the things they want to say, and if they can remember exactly what it is, but you can just go in and be yourself. And if you've got facts on the tip of your tongue, that's wonderful. If you're sharing your story and you're just going in giving your lived experience, also incredible. But just making sure you know what you want to do when you go into a meeting before you step through those doors. Also, we do have a link to an AIDSWatch training video that we did a couple of years ago around various scenarios you could have in a meeting with an office, and a resource on how to prepare for Hill meetings as well. But hopefully this has answered some of the folks' questions around how to engage with offices. We will have a Q&A session at the end of this where we can answer more questions. But I will, for now, pass it to Michael Elizabeth, I think.
Thank you, Drew, for that in-depth guidance. So yeah, consider your environment, just building off of what Drew just said. As we consider our safety planning, right? Like, we're not going to be naive to the environment that we're walking into. Incorporate into your safety plan, like who your representatives are, or senator who you're about to meet with, the offices are. And when I say know them, that means also know their positionality on certain bills, even potentially even beyond their positions on the policies that's in the policy brief. Also know yourself. I know myself, child. So there is one office in particular that I do not attend because I know it will not be a constructive conversation if I'm part of it, because I will call them a bigot. So know yourself, right? But also just know what are your trigger points, what parts that might be a little bit more painful to experience. And so either you or you can, put in requests for the support that you need. And coordinate with your team and your state leads. I highly, highly recommend this, especially with the state lead, even if it's just flagging, right? Like making sure that you in real time letting your state lead know if you're uncomfortable or feels unsafe, etc. I will say Age United has been very intentional this year. Next slide. When it comes to considering your environment, so like they have set aside team members to prioritize your safety. On a Rayburn cafeteria house side, you will have someone who is going to be outlined on the next slide. And then on the Senate side, we will have someone else as well in the cafeteria. Next slide. And these spaces can be used just to decompress, to take a moment, to take a breather. And on the house side, there we go. Oh, I still don't know who's going to be who. It doesn't matter. An AU team member who was just on the other side will be either in the Rayburn cafeteria or the Senate cafeteria in Dirksen. And they're both Black and or part of the diaspora, so you know you're safe. Please contact a couple of partners that Age United is working with, Soapbox Consulting Helpline, or the National Lawyers Guild DC Legal Support Hotline. Please, please take advantage of these numbers. If you feel inclined, I would even save these numbers in your phone, just in case anything comes up. And if you're not concerned about yourself, it might be good just to have this information ready for other people who you might be around. Next slide. Logistical considerations. There are some prohibited items on the Hill that can be found in the link that will hopefully be dropped in the chat. One of the common things that are oftentimes flagged are belts and shoes are commonly flagged. Normally that just requires folks maybe having to take those off as they go through the screening. That just might, impact your time adjustment when it comes to travel. I did see on the prohibited list, bottles larger than 3.5 ounces for lotions or perfumes. If you're a girly like me, that's important to keep in mind as you pack your purse for the Hill visits. I do think it's important to remember or at least screenshot or hold somewhere the single occupancy restroom locations throughout the Capitol Hill area. These are important to know, especially if you're of transgender experience or gender diverse experience, because these are most likely guaranteed safety for you for basic human rights of accessibility to the restroom. Next slides. And again, even if it's not applicable to you, it's good information to hold for your friends and family and other colleagues who might be with you throughout the visits. I will again ask you to pull out your phone, and pull up this link with this QR code. This is a map that AU intentionally is including around all the accessibility entrances for the buildings throughout the Hill visits. And it also includes a mapping of the cafeterias. And again, if it's not applicable to you, it's still good to have just in case you happen to be with people who might need to know this information. Next slide. Scholarships. Next slide. So we had an amazing scholarships selection process this year, thanks to Age United's generosity. But there are some perks to the scholarship program, right? We encourage scholarship recipients to be able to share your story and testimonials with the communication team so they can amplify it and really contextualize why we're here and why we're fighting. We do encourage attending and actively participating throughout the full duration of the conference, including Hill Day, right? Be mindful of your safety, but participation is key. And then participating in the online evaluation of the event in the month following AIDSWatch is also very, very important. Age United is very intentional about making the experience richer and more meaningful every year. And in order to do that, we need the feedback and evaluations. These commitments are very important for your scholarship application and award scholarship. I do think it's important to highlight that most of the scholarship recipients this year are first-time AIDSWatch attendees, so we should be very excited for that. And we always prioritize, of course, those of a variety of different lived experiences. And so they would bring a wealth of expertise and knowledge to our advocacy that we need. Next slide. If you receive the scholarship, you will be staying at the Renaissance Hotel, most likely in a shared room. Please note, scholars are to take full advantage of the financial responsibility for their travel changes in case they miss their flight due to circumstances that are related to an emergency or incident beyond your control. Just be mindful. And communicate in real time with various people that might be helpful, including the AU team, if anything comes up. I think that wraps up anything that I have to say. I'm going to pass it on to our favorite, or one of our favorite, don't get me in trouble, Mackenzie.
Hello, everybody. Thank you again for staying throughout. We're also going to have a Q&A session, but before we get into that, I just wanted to thank our sponsors who help make this event possible and as accessible as humanly possible, specifically Merck, the Elizabeth Taylor AIDS Foundation, and ViiV. But without further ado, we can jump into our Q&A. I know our team has answered some things in the chat. If you want to use the Q&A function on Zoom to input your questions, please feel free to do so now.
Maybe I can kick it off by just summarizing one of the questions that I answered in the Q&A. Someone asked whether the meetings would be with staff members or legislators. And I would have to say, and I've been at AIDSWatch several times so far, and most of the meetings have been a quite sizable group of us with one, sometimes two staffers at the same time. But there have been occasions where a legislator has either walked by and just popped their head in, or one time it was just me and another AIDSWatch attendee and the legislator. It was like a very small meeting, and it just happened that he had a meeting canceled, and so he joined in person with his chief of staff. So my advice would be to expect that you would probably just be meeting with the staffer, but to be prepared if the legislator actually does come in to talk with you all.
And just to build up what Marianne said, meeting with a staffer is not a bad thing. Staffers are the ones on the Hill that do 99% of the work. The dirty little secret of Washington, D.C., or one of many, is that the Capitol is run by 25-year-olds. So if you're meeting with a young Hill staffer, that is not a bad thing. You are meeting with the person who's probably going about helping write the legislation, who's telling their member what they think is important. Member meetings are also wonderful to get to meet the member and have that direct impact. But staff meetings are where the bulk of the work gets done. So please don't take that as not disrespect from the office. Those are the folks that are going to be helping move our issues forward.
Additionally, I wanted to flag as I'm reviewing the chat, these slides and recording for this session will be made available to folks. So, if you're on your phone, what have you, you'll still be able to get these resources via email. And our FAQ page, which was highlighted in one of the QR codes with the soapbox accessible entrances map, that can be found on our FAQ page, which also may answer some other questions you may have. And yes, please reach out if you're a scholar, if you have any specific scholar questions. Meeting masters, specifically Kyle, who you've been in contact with already, can help answer any questions you may have. Bobby asked about their flight being at 5 and, when their meetings would be done. Essentially, we try not to have meetings after a certain time just because we know that's a travel day for a lot of people. But let's say you're unable to attend a meeting that's scheduled for 3, you can interact with your state coordinator and let them know. And you can also let Soapbox know so they can take you off the roster.
I also see in the chat, Greg has asked if have to do a Ryan White 101 for some staffers. The answer to that is a definite yes, but it's also, and your state coordinators and Hill guides will help you with this, it's often good to just take a temperature check with the staffer to see what their familiarity is with HIV-related issues and with Ryan White in particular, so you can know what level, if you're doing 101, 201, 301, when going into these offices. So there's a good chance that a lot of the meetings will be a basic overview of what the various functions of Ryan White are, CDC HIV prevention, things like that.
I see in the chat that we have a question about concerns regarding treatment of immigrants and immigration status, et cetera, on the Hill. I can give a first stab at answering this question, but we'll look to my colleagues to supplement. So far, if I recall correctly, and we're going to keep an eye on it, I haven't yet heard of any particular targeted activity on Capitol Hill buildings. But this is the world that we live in today, and what might be the status now might change very differently by the time we get to AIDSWatch. So I think the best precaution to take is to do what you feel comfortable doing and assume, like whatever risk you feel comfortable. And if going to the Hill is not feasible for your situation, then I would say let's start, send out an email and we can talk more offline to see whether there's a different way, more mindful of those risks that you can participate in Hill Day, not actually on the Hill.
Yeah, and I can just quickly chime in. We're hoping to be able to announce something hopefully shortly around a potential option for folks who might have safety concerns, especially on Hill Day. And of course, we think about our communities impacted by immigration-related policies and trans experiences.
Any other questions y'all want to elevate from the chat? I will say, someone made an important note. When you get your Hill schedules, which will happen next week, probably on Thursday, if you know that you can't attend a certain meeting, please message Soapbox immediately to let them know so they can update their schedules. A lot of time and effort has been put towards scheduling those meetings, so having an accurate roster is really important. Someone asked, this will be my first time meeting with a legislator or even a staffer outside of the information that you provided during this meeting. Is there anything else I should know with how to meet, greet, interact, behave with a legislator?
I think one of the things that you might not guess what happened is that you'll get the staffer's card at the end of the meeting. They'll usually come with a bunch to share with you. So I guess when you're interacting with the staffer, just know that that shouldn't be the only interaction that you have. That won't be. So you might have 5 minutes of time to share your story before someone else is speaking in your group. But that's not the end of that relationship, and that you will have access to that staffer's email inbox at the end of the meeting, and you get the business card, and you can then follow up if you forgot to mention something, if you weren't able to answer a question and you told them that you would follow up. If they were interested in, for example, the role that a really important essential community provider plays in your community, you can always follow up with more information. And so I guess the takeaway there is, don't expect that your role in those meetings is just confined to a couple of minutes. You are now, if this is your first time meeting the legislator or the staffer, this is day one of presumably a lifetime of communication that you could have with this office.
Okay. Jason had a question about a change of attendees. If you have any questions and this goes, past this webinar, any other questions or concerns that may come up, please contact AIDSWatch at aidsunited.org. We can help you field those questions, whether they be around registration, or just any other logistical questions you may have about the event.
And I also see Div has a question in the chat around marginalized, stigmatized groups and people with history in the sex trade, sex workers. Sex worker advocacy hasn't been involved in AIDSWatch historically in the past, both through our policy briefs and our workshops. This year, we did not have a specific ask, I believe, related to sex worker rights, because the traditional federal lens that we did through was the the Safe Sex Workers Study Act that Senator Elizabeth Warren has traditionally put forward to address FOSTA SESTA, and that legislation has not been reintroduced yet. And given the attitude on Capitol Hill, we did not include it in this year's brief. But I think certainly groups advocating for themselves and for people engaged in sex work on the Hill is fantastic. I would also just flag that, keeping in mind the attitudes of the office you are meeting with those asks could be important as well. But it's certainly supportive of that, and please feel free to reach out to us or to your state coordinator if that's something that you wanted to more intentionally do during your meetings.
I also believe that there's definitely one, maybe two workshops with an explicit focus on sex workers and the impact of the HIV epidemic on them. So I would also keep an eye out on the workshop description so you can find that particular one.
I was just going to flag that. Thank you, Marianne. As put in the chat, if you have any accessibility or wheelchair needs throughout AIDSWatch, please contact Sophia. She put her email in the chat, just so we can get that coordinated. I will say, with being on the Hill, all they have available is wheelchairs, but please contact us and we could talk about specifics.
I see that there is, do we have time to answer one more question, Mackenzie?
Yeah.
So I see someone has asked about dress code for the Hill, and question about t-shirt. I think Michael Elizabeth did a great job kind of like describing it. You will get a t-shirt that we all have t-shirts for. So on the day that we go on the Hill, if everyone wears their t-shirts, there's a lot of visibility there, right? You will see, this is what an HIV advocate looks like everywhere, all throughout the halls. People will come up to you and ask you, what does it mean to be an HIV advocate? Why are you wearing that shirt? How come everyone is wearing this particular color? It's a great way to kind of open a conversation and like invite folks to engage with you. Beyond wearing the t-shirt, I've seen folks just wear a t-shirt and pants. I've seen some folks kind of incorporate it into what we traditionally know as business attire, but by no means do you have to. I think dress comfortably so that you can walk, and comfortably so that you can be yourself and be like able to advocate for these policy asks in a way that's confident. So whether that means showing up, however your style is, show up as you.
And with that, it is 2 p.m. But thank you, everybody. Again, if you have any additional questions or concerns, please feel free to email us. And as Bobby mentioned in the chat, we're also going to have a new advocate training at AIDSWatch on the first day on Monday. If you have any specific questions about being on the Hill for the first time and what that may look like. But again, thank you not only to everybody that attended, but to our wonderful facilitators of this conversation, Marianne, Michael, Elizabeth, and Drew. We look forward to seeing you in less than 2 weeks. It's very soon. But thank you so much.